Hi, I'm Meshal Malik, and you're watching Indus Special. Non-communicable diseases, or as they're commonly referred to as lifestyle diseases, such as diabetes, heart diseases, and cancer, are responsible for 70% of all the deaths worldwide. But if this is not alarming enough, health experts are noticing a dangerous rise in their prevalence. For example, with the case of diabetes, the World Health Organization reports that the disease has quadrupled in the past 35 years. The tragedy of it all is that many of our lifestyle choices, such as our eating habits and our physical inactivity, are responsible for the epidemic of these diseases. On today's show, we try to understand the root causes for why more people are falling sick across the world and what needs to be done at a personal level and at a macro level to tackle the issue. Joining us for this discussion is Dr. Sonya Saleem, general practitioner, joining us from London. We're also joined by Swagata Yadavar, a journalist, joining us from New Delhi. Thank you both for joining us and welcome to the show. Dr. Saleem, let me begin with you. Now, what can you identify as being the reason for why there's such a rise in these lifestyle diseases?
I don't think there's one single cause. There's definitely a variety of causes. It's certainly multifactorial. And as the years have gone by, like you said, the number of non-communicable diseases have risen. And these are strongly associated with lifestyle risk factors. And obviously these risk factors, they vary according to country and also within generations. But I would say one of the most important risk factors are that of excess consumption of alcohol and also excess smoking. We've also noticed that more people are becoming more sedentary in their lifestyles. We're having to work 9-to-5 office jobs. We're hardly moving whilst we're at our desks. And by the time we get home, we're far too tired to go out and do some sort of activity. Right. And as a result, we're putting on weight.
Right. And with all of this, do you think that there is enough awareness of all these risk factors? I mean, if the numbers are going up and there's not enough alarmism created regarding it, does it mean that people are just not realizing how much impact their lifestyle has on their health?
That's a good point. I mean, certainly in the UK, we have Public Health England, which is an organisation which helps to promote health amongst all generations, and they do targeted marketing campaigns. For example, stop smoking services, the advertising of that. They're also doing advertisements on the television, making people aware of the safe number of alcohol units that they're supposed to consume on a weekly basis. So it's definitely getting out there, but I think these sort of issues need to start at a very early age. So essentially from childhood, because if you don't get things right from childhood, then that just leads to all sorts of problems later on in life.
Right. And Dr. Saleem, I want to touch upon that point. But before that, I want to quickly jump to Swagata and to her about what do you think if governments are taking this issue seriously enough, especially observing and reporting from this side of the world, from New Delhi? Do you see that governments are seeing this as a priority, as a health emergency, or are they just having a more laid-back attitude towards it?
I think governments are doing enough. But the thing is, in Southeast Asia, especially India, the primary healthcare system is already weak, and it's not enough to cope up with the rising numbers. For example, till the 1990s, the burden by infectious disease was about, say, 60%, and now it's reversed. Now the non-communicable diseases like diabetes and hypertension cause 60% of disease. And as you know, these are chronic conditions. These are not curable conditions. These cannot be reversed easily, and these are expensive to treat. So our systems are already not able to cope with the infectious diseases like TB. For them to cope with the new, extent of these diseases is difficult. It's going to be a challenge.
Right. And on that point, I mean, the World Health Organization estimates that the entire healthcare required deal with diabetes globally is almost $800 billion. I mean, that's a huge amount. And as you rightly pointed out, if the healthcare systems are already weak, how do they deal with this added pressure? Dr. Saleem, to that point, do you think that there needs to be something happening at a global front, at an international front, to create awareness and also to collaborate with different parts of the world in order to have a more sound healthcare system?
I think you're right in the sense that we need to tackle this both at a micro level. So we need to empower patients in making them realize what a healthy lifestyle entails, but also more at a government level. For example, perhaps considering taxation on products such as tobacco products, increasing the price of alcohol, potentially a sugar tax, because at the end of the day, sometimes you need a little bit of a nudge from the higher powers above in order to push people towards a slightly healthier lifestyle. Because at the end of the day, essentially in the UK, we have a tax system. So these chronic diseases lead to so many problems later on in life, and we have to pick up the bill. So from a long-term financial point of view and for the viability of the NHS, it's really, really essential that the government definitely does step in.
Right. And talking about the lifestyles, how they've changed, how much is the government responsible for that? I mean, the way our city centers are being designed, the way our lifestyles are being managed, the working hours, as you mentioned before, there is a rising cost of healthcare. And then on the other hand, there's this aim of maximizing your profits, maximizing development, but it's causing damage to the healthcare system. Do you think governments are factoring that in?
I think they're trying to. For example, certainly in the general practice that I work in, we have on-site smoking cessation clinics where we can send patients to see a practitioner who specializes in stop smoking rather than sending them to services elsewhere. And we also have an exercise referral scheme. So this is essentially a scheme whereby we send people at high risk of diabetes, or those with diabetes, those that are obese, on specific set programs to help them lose weight. I mean, there's only so much that the government can do, and essentially this is going to come out of the public purse. So I think the government is certainly trying its best, but it's more about the individual. It's more about sort of making these small conscious decisions, like, for example, walking to work rather than driving to work. These small decisions that people make on a daily basis that will help.
Right, and that's a very interesting point to make there, that the individual has the capacity to make these small changes that can be beneficial to the larger cause. Swagata, on that point, I do want to ask you and talk this part of the world. Do you feel like fitness and physical activity have been commercialized to such a great extent that the common person cannot avail those facilities? And that's why physical inactivity is on the rise. That's why we're becoming more and more unhealthy.
I totally agree. I just wanted to make this point about awareness, and especially these risk factors that we speak about, the high BP, high sugar level, is no longer restricted to the rich. Now we are seeing these problems also in the underprivileged and the sections of the society. So here is a section which is working hard, but the air pollution is already high in most of our cities. These are the people who do not have LPG, a cleaner fuel to cook. These are the people who are working hard. They are addicted to tobacco products, either chewing or smoking. There aren't enough ways to introduce exercise, and also the increased consumption of junk food, which is available to urban poor as well. So chips and biscuits are available. They are cheap, while healthier options like fruits and vegetables are often very expensive and out of the reach of the poor. So that is, in fact, a big issue.
Right. And Swagata, you rightly mentioned air pollution here. And just for the viewers at home, let's link how these lifestyle diseases are also related to the environment around us. How is the environment impacting our health?
So air pollution is a big risk factor of death and disease worldwide. In India, for example, while the world 16% of all deaths are linked to air pollution, in India around 27% of all deaths and disease are due to air pollution. in air pollution, there are two kinds. One is the ambient air pollution outside, and there is the household air pollution caused due to chulhas. So a lot of our households in India, and I'm sure in Pakistan also, have they use fuels like cow dung and wood and coal to cook, and that has caused a lot of deaths due to chronic respiratory disease. These air pollution also causes heart disease and diabetes as
Right.
well as respiratory. So it increases the overall risk factor for death.
Right. Dr. Saleem, on the point, the patients you see now, and especially those belonging to the younger generations, they're born in this environment, they are growing up in this environment, and we hear more and more about younger children taking more days off from school, they have to go to the doctor more often. Is this really an epidemic, or is this claims, are they just hyping up the emergency? What is your expert opinion on this?
So I would say that this is an epidemic, because in the past it used to be mainly communicable diseases, things like TB, measles, mumps, and rubella, which were prevalent. But now we're seeing a really sharp increase in the number of diabetes, hypertension, and we're seeing more and more of these cases in the younger population, which is actually quite surprising, even though they should actually, in theory, be more attuned to knowing what a healthy lifestyle constitutes. I mean, there's so much more literature out there for them. Schools are also changing their meals. For example, we're getting rid of vending machines selling junk food. The meals that are being served in schools are so much healthier, less fried, fatty foods. And there's also an increase in physical education. So, and in some schools, that's become a compulsory element. So it's actually quite strange to notice that we're seeing more and more young people who are becoming more obese. And that's being picked up by the National Child Measurement Programme. So this is an initiative set up by the government, which monitors the height and weight of children as they progress through school. And it highlights children that become overweight or obese, and that allows us to tackle these problems earlier on. So unfortunately, it is the case that we are seeing more patients of a younger developing these problems.
Right, and Dr. Saleem mentioned the strangeness of it all, that with all the literature out there, with all the awareness, you're still seeing a high number of people who are facing obesity. Why do you think that is? Like, if you had to pinpoint the reasons as to why this is emerging as a trend, what would those reasons be?
I would certainly say that the availability of healthy foods, especially the pricing. I mean, the pricing of healthy products is ridiculously high. And if you're a poor person, you know, with not very much in the way of good means, I mean, it's very, very difficult for you to make that choice and actually purchase healthy products when actually you can get junk foods at less than a third of that price. And also, I suppose, in terms of our lifestyle, a lot of children are becoming more and more attached to social media. They're spending more and more time on their laptops. They're spending less time outside. For example, 20 years ago, I mean, we hardly had the internet. I mean, you know, kids were outside playing, running around, whereas now a lot of the kids are glued to their PlayStation, they're on Facebook, they're on Twitter. So it's just about sort of trying to get them back out where they should be, where it's so much more healthier, both for their mental and their physical well-being.
Right. Swagata, something interesting that Dr. Saleem mentioned in all of this was the affordability factor, the accessibility of healthy food. We assume that getting organic food, the problem is that it just doesn't taste as good. But the problem there is also the price and the fact that it's becoming more and more difficult to access. Contextualize that for us in the case of South Asia, in the case of these developing nations that are battling with this health crisis.
Yeah, and I think as much as we keep talking about the individual choice and lifestyle, what we do not see are the invisible market forces. For example, food industry. It is everywhere. It's pervasive. It is, advertised to children. There are infant products which have sugar in it. Every other product which is packaged has sugar and salts in it. and has artificial chemicals in it. So those are the foods that are easily available. Parents who are busy, who cannot afford to cook every meal, will give these foods to their children. Same with lifestyle diseases, and I mean, activities like exercise. When we tell people to exercise, but the air outside is highly polluted, as it is in Delhi and many North Indian as well as South Asian cities, what do you tell people? Do you tell them to exercise where the air quality is about 20 times the WHO safe levels? It makes no sense to constantly blame individuals when governments and the larger forces are not doing enough. Another point I want to make is about screening. What happens among the poorer section is they are detected with diabetes and heart disease, but it is not until they have a heart attack do they know that they already had these conditions.
Right.
That is because they cannot afford to go to the doctor with smaller, when things aren't that serious, because that they will lose wages if they go to doctors. So screenings have to be put in place. We have to screen population across the board for high blood sugar level, for high BP, so that we can, this awareness needs also to be targeted to populations. So
Right.
every person above the age of 40 should know their blood sugar level, should know their BP.
Right, and those are a number of very, very important points you highlight there, and I'd like to talk about them, but specifically focusing on the food industry, you talked about how the invisible forces are at play, and it's surely the case. I mean, we see advertisements geared towards targeting children that talk about unhealthy foods. Do you think legislation needs to be strengthened in this regard to make sure that these products are not targeted and advertised to the children as they are?
Yes, totally. So many of the South Asian countries as well as WHO has banned the marketing of infant foods. For example, they are not allowed to advertise these on TV. But in the older section, there are many foods that are specifically targeted to children and which are aired on the channels that children watch. We do not do enough for that. We don't do enough for the sugar beverages that are easily available that children want to eat. We do not do enough for the other biscuits and other packaged foods. So there aren't legislation, and there are strong lobbies of these industries that prevent any kind of sugar tax that, doctor mentioned. So it is pervasive. It is difficult to control.
Right. And doctors, talking about this with Swagata, you also being from a completely different part of the world, living there, seeing the lifestyles, do you also witness that? Do you also witness the pervasive invisible forces at play when we talk about having an unhealthy lifestyle? There are many other things happening in the background we don't take into account.
Most certainly. These are things that we refer to as the social determinants of health. So I've actually worked in a quite a rather less affluent area, if you may say so. I have noticed that invisible forces such as, people being in poverty, lack of availability of services nearby, for example, local gyms, local youth clubs. I mean, people essentially do not have the money to go outside and actually purchase a gym membership or purchase, healthy foods. And I've also noticed that I've worked in an area which has a high proportion of ethnic minorities, particularly the South Asian population, and we're already at a high risk of developing these chronic diseases because of our genetic predisposition. And, I do find that sometimes educating Asian women in particular, that can be a little bit of a challenge. And that might be because of cultural reasons, traditional reasons. A lot of the women might be expected to stay at home and less likely to go outside in public to exercise. So it's just about sort of breaking those barriers, making it a little bit more accessible to women in particular. And I think we are definitely trying to do that with the availability of women-only gyms, women-only swimming sessions, just making women, especially from our ethnic background, a little bit more comfortable in exercising so that they can better their health.
Right, and those are very important points you've given us to carry this discussion forward. And thank you. Note, Dr. Sonya Saleem, for joining us from London. Swagata, going back to you and listening to how Dr. Saleem talked about the accessibility to awareness programs. Now, that is a key issue, something that you mentioned as well. People need to be aware that they need to be screened before a certain age, that they should be aware of what their blood sugar levels should be. All these things should be in check. But that also brings us back to the point of how do you communicate these things to them in a way that it resonates, in a way that it's accessible information, and that it makes sense?
I think public awareness campaigns that governments are running are very important, and there also need to this public movement towards healthy lifestyle and healthy foods and making these accessible to everyone. That should be. And the role of sugar is something that we don't talk about. There is so much focus on fat, and not enough on sugar. Sugar is one of the biggest risk factors. It is the risk factor for diabetes. So let's just talk about the risk factors. Let's make the communication more simpler. And having our celebrities talk about these risk factors. Say smoking, there's this large scale awareness about the harms of smoking. We don't see that much about sugar that way. So we need to talk about even foods. And there are these commercial interests that we spoke about.
Right.
But there's a need to have more objective communication that talks to people in the language, in their regional language, about risk factors, and also the importance of screening. We need to reach out where people stay and screen them.
Swagata, sorry to interrupt her, but as you mentioned previously as well, there are very, very strong lobbies that are advocating for their products to be sold the way they're being sold, for them to being advertised as they're being advertised. I mean, they almost have a monopoly over markets, over advertisements. With all of this, don't you think there will be a clash of interest when we're talking about greater awareness?
Of course there is. There's even a big tobacco lobby, which is currently, constantly preventive this kind of information, public health awareness information going out, even in India. So this is a lobby that is trying to stop these advocacies from even existing. So there is this constant threat from the industry to prevent good information going out. But then as more and more politicians realize the importance of health as a political priority, that they cannot ignore health when they talk about other issues in the constituency, they will have to take up these. Like in India currently has a national health protection scheme called as Ayushman Bharat, which is covering all the poorer sections of the society for about 5 lakh rupees every year. They know that most of these diseases that people are hospitalized are non-communicable diseases, are heart disease and diabetes. And the only way to stop is to create awareness. So once these two interests clash between the lobby as well as the politicians, maybe we need politicians to be better health advocates. And that is the only way that we will get this information and good policies out.
Right. On that note, thank you so much, Ms. Swagata Yadavar, for joining us from New Delhi. When we return, we're going to talk about the connection of mental health to non-communicable diseases and how the stress factors in our society are rising. Stay with us. Welcome back to Indus Special. While we continue our discussion regarding non-communicable diseases, now we're joined by Dr. Asmus Hammerich, who's the Director of World Health Organization Department of Non-Communicable Diseases and Mental Health. He's joining us from Cairo, Egypt. Welcome to the show, Dr. Hammerich, and thank you so much for joining us. Now, we've talked about how this figure is rising, how non-communicable diseases are becoming more widespread. But from your observations, in which regions and which populations, which ethnicities are more at risk of these diseases?
Well, thank you very much for this interview and for your interest in the work of the World Health Organization in our region here, the Eastern Mediterranean region. When we talk about non-communicable diseases, indeed, we try to focus on the main risk factors and the main risk factors for non-communicable diseases. And when we say non-communicable diseases, we mainly mean cardiovascular diseases, chronic lung diseases, diabetes, and common cancers. And the risk factors we focus on are tobacco use, harmful use of alcohol, an unhealthy diet, and physical inactivity.
Why do you think that these regions are more and more vulnerable to the rise in these diseases?
Well, NCDs, as you say, are unfortunately on the rise also in our region, with about 2.6 million people dying from NCDs, or died from NCDs in 2016, representing a mortality of almost 63%. So 2/3 of all our people in our region are currently dying from NCDs, the diseases that I mentioned. And the NCDs are, of course, a result of a combination of genetic, physiological, behavior, and environmental risk factors that lead to those chronic diseases. And the diseases are, of course, characterized by their long duration. That's why they used to be called chronic diseases.
Right. And as you mentioned the region here, I also want to ask you if culture impacts these numbers in any way. Culture impacts the rise in these diseases. I mean, we talked earlier about how stress is a factor, how about the lifestyles are a huge factor. Does culture impact in any way?
Absolutely. So NCDs are usually or commonly driven by underlying socioeconomic, cultural, political, and environmental determinants, such as urbanization and the globalization of unhealthy lifestyles, as well as an aging population. And those changes in lifestyle that we see all over the world, including in Pakistan, of course, are causing an increase in those risk factors that I mentioned earlier. And this is in addition to rising air pollution that results in other metabolic risk factors such as high blood pressure, increased sugar in the blood, elevated fat in the blood, and that in turn leads to those diseases such as heart disease and stroke and diabetes, for example.
And Dr. Hammerich, from the trends that you've been observing, what predictions can be made for the future?
Well, unfortunately, they're not going away. They're here to stay with us. And whilst we do see some encouraging trends globally and in some countries and in some parts of the world, in terms of, for example, tobacco trends going down and even blood pressure falling, I think the overall challenge is huge, and it's also, I think, huge in middle-income countries such as Pakistan at the moment. So we have to accelerate our efforts.
Thank you so much, Dr. Asmus Hammerich, for joining us and talking to us. Now we're joined by Dr. Amir Mir, who's a general practitioner with a special interest in mental health and diabetes. He's joining us from London. Thank you so much, Dr. Mir, for joining us. Now, we've been talking about these diseases and we've been focusing on the risk factors associated. Physical inactivity, more unhealthy lifestyles, food. But something I'd like to talk about is stress and how that's relating to the rise in these diseases we see today.
Thank you very much, Meshal, for inviting me. And it's very good to have a global review from different participants. So it does help. So looking at the global picture, and you mentioned about anxiety and depression, in particular relation to the non-communicable diseases. I would say that anxiety and depression, it plays a big role. And if you look at the diseases, these non-communicable diseases, they are mainly chronic diseases, and the progression is very slow. And like a cardiovascular disease risk is the highest according to WHO report. And like myocardial infarction, heart attack, stroke, diabetes, and cancer. And as you know, that these are chronic conditions, and they have a strong link with the depression. And the people do suffer from anxiety, depression, There is a lot of role of isolation, lack of family support, and obviously for a long time suffering, they do feel depressed and isolated. And if there is no support available in the family, in the community, obviously the things can go worse.
Right.
So it's not just controlling disease symptoms; it's treating with the mental well-being, which is most important part.
Right. And Dr. Mir, earlier we had Dr. Saleem talk about how it's very evident that younger people are becoming increasingly more prone to these non-communicable diseases, and that's strange and that's also surprising. Now, we also know that depression and anxiety rates in young people are also almost at an all-time high. Why do you think that is?
It's a very good question that you're asking about the younger people, younger generation. I would say that, as Dr. Saleem mentioned early on, that the younger children, they don't involve in exercise, and they tend to stay indoors and do all sort of activities like using social media, Facebook, Twitter, and other activities, and probably there is a lack of support from the school, and they don't have the awareness, health awareness, to overcome this issue. This is a major issue even in developing countries, and we have a different setup here, and we do promote health, and as you know, that the prevention is better than cure. So curing a disease, it costs a lot of money.
Right.
But if we can prevent diseases and create awareness through paper media, social media, and electronic media, and maybe we can create this
Right.
kind of awareness in schools, at the malls, and we can set up a clinic, a walk-in clinic type to screen.
Right.
And
talk
to these younger generation.
Right, and Dr. Mir, as you mentioned here, that prevention is a much easier thing to do and a much important thing to do, as cure becomes much more costly, and it also, for these non-communicable diseases, there is no cure. So when we're talking about prevention, how important is early intervention, especially when it comes to children? What age should parents begin to teach them about a healthy lifestyle, and what measures can they take to ensure that that the risks of developing these diseases is minimal?
I think it starts from the in utero. When the moms become pregnant, and they should be fully aware of all the risk factors, and they should be on a good diet, exercise, and they should eliminate all the risk factors. So this is how we can build up prevention.
Right.
And once the child is born, then through the child surveillance, immunization, and the good family support, and of course the government support, and if we have a strong primary setup, that certainly helps, and that is the role of that's the role of the government, that they should provide the basic need. Like a health, a standard of health, they should improve. They should provide clean water, clean air, the basic needs. So that is the government's duty, state duty, to provide such basic facilities to the public to prevent these diseases. And
right.
if we don't do, obviously this will create a lot of burden on health economy, and the government is already under stress. And
Dr. Mir, give us a picture of how under stress the economy is because of the health issues, and how much damage there will be to the economy in the future if we don't take a hold of these problems.
Right. Very good question. If you look at the WHO report, it clearly states that the risk of non-communicable diseases is more than 71%. And the mainly these diseases are common in Southeast Asia. And obviously we face more burden in terms of controlling communicable diseases, and as you know that that's the major problem of underdeveloped countries, and if we are already under burden to control communicable diseases, so we will definitely have less resources to combat with the non-communicable diseases. And obviously, these diseases can be prevented, can be cured, and we can actually do a lot of saving. But we have to have set policies, priorities, and we need set primary care set up. And it's not just public awareness. It's the government cooperation of different departments and institutes. So it's a multi-sectional approach of the government.
Right. And Dr. Mir, just the last question to you, something that we were talking about earlier as well, but since you mentioned that the policies in place need to tackle the issue and it needs to be done at a macro level, I do want to raise this point and ask you about it as well. What about all these advertisements and all these lobbies of unhealthy products, whether it's the tobacco lobby or the powerful industries that sell junk food? How must they be reined into the system in order to make sure that health is given a priority as opposed to advertisement and revenue?
Right. That's a very good question. And I think we need to compare in various regions. And I can give you an example of United Kingdom. We have a very strong policy, and we do review and monitor our health policies, and the new approach, like the government introduced a new legislation that the fast food chain should not be close to schools because of easy access. So that is playing a major role, and the government could put ban on various unhealthy foods, and obviously. All these unhealthy foods, they are causing all the problems. And that ban can come from the state, and that would help a lot. We do have a sugar tax here, and
right.
I would also mention that other area we can cover, like salt. We use a lot of salt, and that causes high blood pressure, and it gives a heart attack, stroke, and all these diseases. And we need to, if we can put tax on salt, like sugar, so certainly we can reduce the burden.
Right.
And we can achieve a healthy lifestyle.
Right. And Dr. Amir Mir, thank you so much for raising those important points and highlighting them for us. Thank you. That was Dr. Amir Mir joining us from London. Thank you so much for talking to us. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.